fingers, but mostly in the upper thoracic up to like maybe here.
Okay, can I move the hair a little bit? Okay, so
Going like this, coming back to the
Yes.
middle. Okay, so it's like a classical trapezius muscle pain. Okay, are you doing a lot of stuff with your phone, holding your head downwards? This is an acupuncturist disease, actually, because
Right.
because our head is always looking down, facing down. Now it becomes everybody's problem because of the phone. So you can't tell acupuncturist anymore. So can you show me with one finger the most sensitive area?
I think, maybe here and
Okay,
here.
so it's actually a very big area. And as you can tell, she cannot really put her finger on it. So shoulder blades are really tricky. If you ever treated a shoulder blade like with Twain-Hour stuff, or massage therapy, you always come and somebody said, yes, that's the spot, right there, right there. Then it becomes softer, and then he tells you, no, it moves, it's not the spot. The spot goes a little bit lower, and then you go lower and say, yeah, that's the spot right there, and then you work for an hour, and then he says, no, it's the same. Because the muscle, it's actually, the taiyang here is full of blood, but when they say full of blood, they mean the taiyang doesn't have a major blood vessel. It's like a blood bath going on up there, and it's a lot of connective tissue. And we have three major part of the back that has mostly connective tissue. This is one part. We have here another ligament, and then we have a huge part here. And these parts are very, very painful because they don't get enough blood, although the taiyang is full of blood. Okay, so we need to find that. Is there any difference between right and left for you?
Maybe the right.
Maybe. Okay, so can I check it?
Yeah.
After the patient giving me this kind of, I need to check it just to make sure. Is it like that, or is it more this? It's to the side.
Sides.
Okay. And how about this? Yes? I think this side is more sensitive than this one.
Yeah.
Yeah.
Okay. Yes.
So, are you agreeing with me?
Yes.
That's left side. Actually, you can play guitar here. In here, you cannot play guitar yet.
Yeah.
So one of the things I'm doing, I'm using a trick for shoulder blade. I'm going to use 2 points called chunzi chung xie, which are on the palm here. And that clears a lot of the territory here, and then we'll see what's left. Okay, so let's find these points. So the points are like that. You go from the pericardium 7, to the fold of the thumb. And then you divide this line here into half. That's 1 point in the middle. And then you divide this part to 3 parts, and then another one is here. Okay? But you could go out and find.
Heidi, I'm sorry, can you show me the 3 again?
Yeah, that's.
Where's the starting?
The line goes from the crest to the pericardium 7. One time, you take this line and you divide it into half, that's the middle. That's 1 point. One time, you take the same line, divide it into 2 parts, and then you leave one in. Okay, so it's 1/3 and 1/2 of the same road.
Yep.
But that's always the classical point. So I'm coming to her hand, in the clinic, I'm taking this line and I'm always finding the ashi here. Okay. So your tunnel muscle is very, relax. Sometimes it's thick, so you can come only from one side to find it. Sometimes it's a little bit more soft. So you just need to give yourself support from the other side, okay? So, is there something here? Oh, I like this finger. Here, a little bit sensitive to the deep side. How about this one? Or this one? Not so much, just the midline.
Yeah, I
The
think that
midline
might-
is good. Okay, so let's start with the midline, see how it works. And I use the opposite side to where it's painful, but It should work on both sides because this is actually lung line in a way, and this area is bladder line, so lung treats bladder on both sides. So again, taking out this tube, I take the tube. Going back, that's the spot right here. Then maybe if you don't want the needle to hurt too much, hold the left finger on the point a little bit longer, then it's going to be less painful. If you work on 7 patients at the same time, then don't worry about it. Let them scream. Okay, needle in. See, that wasn't so bad. Mm-hmm. Yeah, and then you get cheese sensation, a little bit. Yeah, that's a little bit. It's not strong enough. You see, there's probably something with the lung. Not, you see, this. Can you bring the camera in?
You got it.
For all the people in the world, see, you see this bluish thing here? That means the lung is not tonifying the finger properly, and then we need to find something going on in the lung somewhere that's blocked. Okay? This is why now it's stronger. See? Now it's a little bit stronger. So we see. You have some breathing problem?
Not that I know of.
Yeah, maybe it's just a breathing habit problem. Okay. How is it here now when I touch it? Is it
It's
chain?
not. It's not as tender.
Yeah, it's not as tender. I can't play
But it
the-
still feels tight.
Yeah, it's
just
tight, but
feel-
I can't play the guitar here now anymore.
Are you on the levator scap muscle?
No, actually, this is the trapezius. You can't really feel that muscle. You can only feel the trapezius is too big on the outside. So first time, it really cleared half of it off. Now we just move on to the images of the shoulder blades to the leg. Because I need to treat the gallbladder, I need to treat the small intestine running through here, I need to treat the Sanjiao. So I go to the leg. Yeah, I know. I probably need more than 4. I'm
Just the right one? Or?
I'm very long, so be careful. Let's go. Can you lift it a little bit more upward? So I'm going to start with this side because I'm going to use liver and kidney. Since I already treated the bladder, I'm more into treating Sanjiao and small intestine now. Sanjiao and small intestine, if I use liver and kidney, they work on both sides. So
you're
I'm
working on Sanjiao and small intestine right now?
Yeah, Sanjiao and small intestine here, and it's going to work on both sides. Because liver treats small intestine, system number 4 treats both sides, kidney treats Sanjiao, system number 2, both sides. Okay? Always check me out.
It could be wrong.
Of course, like everybody can be wrong. So now I'm going to show you something with palpation to find ashi. First I go like this on the skin to see if some feeling comes to my hand. Some people are so sensitive that this starts to burn, so it helps me. I don't go automatically to this because this could be painful for many people. Then I go a little bit more to the massage part. I just want to feel the meridian. Where is it empty and where is it full? So you see, I can feel this one is rather empty, while this one is much fuller. Okay? Then I want to go to the liver line, just to feel it, just to feel how it feels under my thumb. After I have these feelings in my hands, I need to go to the ashi. So I will probably go to around this one. No, it's going to be a little bit lower, like here.
I get your, no, I got
Yeah, this one.
that.
Then your kidney line is not very sensitive. Not very sensitive, the kidney line. So I'm putting it to the side of my brain. Kidney line is not very sensitive. I want to treat Sanjiao still. I will go to the spleen line. How about this one? Is it a little bit more sensitive? Yeah. Spleen line is a little bit more sensitive, so I treat the Sanjiao with the spleen. Then liver line, that's the most sensitive one. Okay? Here it becomes, yeah. So I'm gonna go on this area right here.
So
Okay?
You're not imaging right now.
Of course I'm imaging.
Okay, so if we're thinking about the back and the inside of the leg, is it this image that I'm thinking about?
Yes. So somewhere between spleen 5 and spleen 7. And the same height for liver line. Can you make me 5 needles with no tubes, please? Tube is plastic, and plastic is a horrible. No, it's not because of that. I don't use it. But I'm trying.
So gullible.
No,
Yeah.
It's Chinese never uses tubes. Okay, so we go in. 1. Of course, normally I don't put myself in the seiza position to treat people.
Are you angling the needle in a certain way?
Yeah, the angle is the same one I find the ashi. Are you okay?
Yeah, I'm good.
No, I'm not asking you. I'm asking the patient. Are you okay?
I think
Yeah, the
so.
rest of us are.
No, I'm saying okay with the pain. Is it too much painful?
No, that's not painful.
That's not painful. That's cool. Yeah, that wasn't narcissistic at all of you.
How deep are you going?
What?
What are you looking to feel?
No, I find the ashi before. Now I'm going back to the same points and just making sure they're still empty and sensitive, and then I put the needles in all the way until I find the tissue planes that I want that feels like the tissue planes on her back,
Okay.
which is connective tissue, actually. Connective tissue and muscle. I don't want to feel like an emptiness or a bone. So even if I go here to the liver line, okay, I will try to find my way into the deep muscle I told you about, which is pretty much here.
Is that off, right off
Ow.
the bone?
Ow,
Ow.
yeah, that's cool.
Now that hurts.
That's the ow I like so much. So again, actually what I should do is put my finger and make sure it's easier. No,
Fingerprints are weird.
And make sure what? You
Is that
started to
edema?
say, put your finger and.
then it will not be that painful. The needle is going in.
It looks like she has edema there. I mean, it's pitted from this.
No, the thing is that if I probably do some deeper questions and answer, I'll probably find that she's not drinking enough. And
Now, that's not your usual angle for inserting on the liver meridian?
no, that's a liver line.
Yeah, I know.
Yeah.
Is that the angle that you usually use?
Yeah, that's my angle usually. When I want to touch the muscle, not when I want to reach the bone, because now I'm fixing it a little bit. See, I mean, now I'm in the bone. You see, she feels it. Now I need to go this way. Okay.
So for those of us who haven't learned all these different techniques in terms of insertion.
What do you mean? You just put the needles in.
Right, but I mean in terms of, feeling and go on the side of the bone, going to the tendon, that type of thing. It seems like there's different insertion techniques.
No, it's the same insertion technique. It's just how deep do you go. This you translate it into ashi sensation. Okay? Now, can you move it a little bit? See if it's. How do you feel now? Then you see the mom. You see the answer on her face. They're smiling. Yay! Now she looks for the pain. Where is my pain? Bring me back my pain.